All right, hello everyone. We're Alpha Zeta Alpha, or AZA, and welcome to our presentation today on the impact of the COVID-19 pandemic on opioid overdose deaths amongst racial and ethnic groups in the United States. My name is Ton. I'm an undergraduate at Johns Hopkins. My pronouns are he, him, and I have the pleasure of also introducing my teammate, Richie Chu, a master's student at public health at the University of California, Los Angeles, and Sai Sonala, an undergraduate student at the University of Pennsylvania. Begin by giving a brief background about the current state of opioids in the United States. Since 2000, opioid overdose deaths have been increasing at an exponential rate in the US across virtually all demographic groups. The CDC found that more than 136 people die every day from overdoses involving prescription and illicit opioids. In 2017, the Department of Health and Human Services declared opioid overdoses a public health crisis due to the increasing prevalence of opioid-related deaths across the United States. This trend has continued during the COVID-19 pandemic. However, there have been few studies that explore exactly how the pandemic has impacted opioid deaths across different racial and ethnic groups. And therefore, our goal for this project is to understand how the COVID-19 pandemic has impacted the prevalence of opioid overdose deaths and the intention of opioid use amongst racial and ethnic groups.
Awesome. So going on to our methodology. So we conducted an observational cross-sectional study using data from the National Vital Statistics System, also known as the NVSS. And the NVSS has data for natality and mortality. And we looked specifically at the mortality component, which is obtained from death records filed in the states and the US territories. And so for our inclusion criteria, we looked at opioid underlying cause of deaths based on International Statistical Classification of Diseases, also known as the ICD-10 codes, which is coding used by physicians and other healthcare providers to classify and code all diagnosis, symptoms, and procedures. And so the codes that we used are listed here on the screen. They're listed by the intent of opioid use, including unintended overdose, suicide, homicide, and intent undetermined. The racial ethnic groups that we looked into were the non-Hispanic whites, non-Hispanic blacks, non-Hispanic Asian American, Native Hawaiian Pacific Islanders, non-Hispanic American Indian and Alaskan Native, and Hispanic Latinx. Our two comparison groups was the 10 months before the pandemic from May 2019 to February 2020, and the 10 months after the pandemic from March 2020 to December 2020. And so now moving into our results. When looking at the data, we found that about 61,000 opiate overdose deaths before the start of the pandemic, and an increase of about 79,000 opiate overdose deaths after the start of the pandemic. We drilled down the data even further to look at the opioid deaths among the racial groups we were interested in. And from here, we conducted a longitudinal analysis and calculated opioid overdose prevalence rates per 100,000 people based on state population using the American Community Survey data. And so we had three main findings. The first one, as just stated, we found that opioid overdose deaths increased during the COVID-19 pandemic. So in this graph, you can see this vertical blue line marks the start of the pandemic in March 2020. To the left of the blue line are the 10 months before the start of the pandemic, and to the right of the blue line are the 10 months after the start of the pandemic. On the y-axis is the crude mortality rate per 100,000, and you can see that when the pandemic started, the crude mortality rate increases from about 4 to 5.5. And so the COVID-19 pandemic exacerbated opioid overdose deaths. In our second finding in this graph, we found that opioid overdose deaths have very really increased in every racial ethnic group since the pandemic. On the y-axis are the different racial ethnic groups, and the x-axis is the percent increase of opioid deaths. You can see here in this graph that in all groups, they had a percent increase, and in opioid and for non-Hispanic whites having the smallest increase at 24%, and every other minority group having increased of more than 35%. With non-Hispanic American Indian and Alaskan Natives having the highest increase at 47%. Finally, we found that the proportion of intentional opioid overdose deaths have decreased. In this diagram, each blue dot represents one intentional self-harm opioid overdose death per 100 opioid overdose deaths. And on the left, we have the proportion of intentional self-harm opioid deaths 10 months before the start of the pandemic. And on the right, we have intentional self-harm deaths 10 months after the start of the pandemic. Each row of dots represents a proportion of intentional self-harm for each different racial group. And we initially thought that intentional self-harm deaths would increase since the start of the pandemic. However, to our surprise, we actually found the proportion of intentional self-harm opioid deaths decrease across all racial groups. Notably, this proportion remains the highest in non-Hispanic, Asian American, Native Hawaiian Pacific Islanders. And we thought this is interesting because this has been consistent with past studies showing that Asian American young adults being the only group suicide as their leading cause of death.
All right, so let's take a deeper dive into our major findings. So the first major finding that we had was that after the start of the pandemic, we observed that there is a drastic but variable increase in opioid overdose deaths across the board for all racial groups in the US. Notably, minority groups, which include Hispanic, Latinx, non-Hispanic Blacks, non-Hispanic American Indians, and then non-Hispanic Asian Americans, all experienced 36 to 46% increases in opioid overdose deaths, as opposed to non-Hispanic whites, who only experienced a 24% increase in these opioid overdose deaths. A secondary finding of our study was that Asian Americans remain the racial group with the highest proportion of intentional self-harm opioid overdose deaths at 11.43%. And in fact, they more than doubled the next highest group, which is non-Hispanic whites, who only have a proportion of 5.4% for intentional self-harm opioid overdose deaths. We observed 3 limitations in our study. First is variability in the local and regional death reporting and death coding practices, which can cause inaccuracies in our global NVSS dataset. We also observed that there were low Asian American death counts for these opioid overdose deaths. And this could, because of the limited data, it could mean that our findings need more data to be actually significant. But it is important to note that the fact that there are small Asian American death counts means that the Asian community is standing strong against the ongoing opioid epidemic. And then finally, we observed that we only use 10-month time periods in our data, and that limits our total data in our study. The reason we use the 10-month time periods is because the NVSS data set only has data until the end of 2020. So we analyzed the 10 months after the start of the pandemic till December 2020, and then 10 months before the start of the pandemic in the 2019 NVSS data set. And although we have limited timeframes, our study analyzes the immediate effects of the pandemic on opioid overdose deaths and sets the stage for future studies when we have more data. So going back to our initial research question, we conclude that the pandemic has drastically but variably increased US opioid overdose deaths across all racial groups. And a secondary finding was that intentional self-harm deaths remain highest in the non-Hispanic Asian American racial group. In terms of future study, our team really wants to look into county data and metropolitan status and urbanicity as it relates to these opioid overdose deaths. We also observed that there is a slight increase in accidental opioid overdose deaths. And so we want to see if gabapentin, a anticonvulsant drug, has been implicated in these deaths, as it's been reported that gabapentin has been involved in 1 in 10 opioid overdose deaths in 2019 and 2020. We also want to look into the types of opioids that people are using and overdosing on, especially with special emphasis on fentanyl versus non-fentanyl opioid overdose deaths. And finally, we want to look into the social factors that underpin the varying effects of the pandemic on the opioid overdose death increases across racial groups. And that concludes our presentation. We just want to give special thank yous to all of our mentors, Dr. Gross, Dr. Kim, Tina, Dr. S, and Dr. Panyapin. Thank you so much for being amazing mentors this summer. And we are now open for questions.